Speaking today were the Intergovernmental Affairs Minister Dominic LeBlanc, Health Minister Patty Hajdu, the Defence Minister Harjit Sajjan, and Public Safety Minister Bill Blair. And as for how Ottawa will be helping Ontario, it includes a deployment of federal healthcare staff and equipment to the front lines of the province, boosting rapid testing and supporting contact tracing and isolation efforts. And this includes $84.2 million to support voluntary isolation sites in Ontario. Also, $46 million to fund virtual health care during this pandemic, and providing an additional supply of drugs, specifically a drug called tocilizumab, to treat severe pneumonia in COVID-19 patients, and other drugs through a reallocation of what's given to the provinces and territories. The Prime Minister also reaching out to the premiers of Newfoundland and Labrador, PEI, and Nova Scotia. The Intergovernmental Affairs Minister reaching out to the Premier of New Brunswick to see how other provinces might also help Ontario. Now, for more on this, we have invited to the program Dr. Zane Chagley. He was listening in. He's an infectious disease specialist who joins us in Mississauga, Ontario. Dr. Chagley, thank you for being here.
No problem.
So first, I want to get your reaction to the help that's now being extended to Ontario by Ottawa. Will this make an impact?
Yeah, I mean, with every disease, we have a paradigm of primary prevention, so preventing the disease from happening, secondary prevention, early diagnosis of the disease when it's happening, and tertiary prevention, so preventing death and disability. And I think the federal government has really helped strengthen that tertiary piece in terms of healthcare workers, supporting some of the non-conventional spaces that we'll likely have to open into in this wave. Extra testing is certainly important for, diagnosing people early, helping with contact tracing, and virtual care will do that. Having available medications like tocilizumab will help with that. The piece that's still missing in all of this is more primary prevention. Ontario could be benefited so much by helping preventing people getting COVID-19. And that includes more vaccinations, which unfortunately doesn't sound like are coming. And it includes more supports for essential workers. And again, more mobility in the Canada Sickness Response Benefit to really allow for what would be paid sick day pay to prevent people from becoming infected and not having to deal with the consequences of it in our hospital.
Well, you use the word primary, and there was a question during that news conference that was essentially prefaced with an argument that Ontario wouldn't even be in such dire straits if the Ford government had listened to its own scientific table and the modeling that was presented back in February. What would you say to that?
Yeah, I mean, I think it does make it a bit simplistic, right? And realize, again, much of this wave is not necessarily just behavioral. There are people that are being put to work despite lockdown measures. These people don't just benefit Ontario. They don't just benefit Toronto. We have large Canada Post facilities. We have an Amazon facility in the GTA that supports the rest of the country. And so, I think it's a little too simplistic to say, that one province did what was right and the other province did what was wrong, when the people getting infected aren't the ones that are necessarily going to be helped with the public health measures. They're the ones that are being put forward in the context of everything so that many of us can stay at home, many of us can do the right thing and support our ability to shelter in place while still have the resources and supplies that we need for day-to-day life.
Does it require a re-examination of what's defined as essential?
Yeah, I mean, I think there's certainly a lot of calls here in Ontario to look at what are essential workplaces, ones that are not essential, even for a couple of weeks to let cool off. We know workplace transmission is growing. Even in Toronto, yesterday, there were 542 active cases related to work, and many of those see the community. Any one of those workplaces that can be closed down now, really needs to be considered. And those that can't be closed down now, again, prioritizing vaccines as much as possible in them and their communities to make sure that they're protected while we go through these public health restrictions.
Now, as we said, other provinces are also being asked right now to see how they might help Ontario out. What would be helpful? What would people be doing if they actually, say, for example, went from Newfoundland and Labrador to Ontario? How would they be deployed in this province that would have a major impact?
Yeah, I mean, critical care healthcare workers are a resource now, and again, our ability to scale up our ICUs based on the projections of 1,000 to 1,500 people in ICU, especially in some smaller hospitals that may not have the capacity to actually deal with it or the human resources in their community, would be hugely important for us to make sure that everyone has access to a high quality ICU bed if they do need it. More contact tracers are really important. The ability to actually reach people appropriately who have gotten COVID-19, the ability to turn around tests quickly. That'll at least help mitigate some of that risk, and again, get people in isolation as fast as possible to mitigate the spread of COVID-19.
Okay, and I know you referenced it earlier on, but I want to be very clear as we end this conversation, Dr. Chagla. I want you to essentially write a prescription here. If this is the federal help for Ontario, for the people of Ontario, for the government, what else is needed? What's the prescription going forward for this province as it deals with the crushing third wave?
Yeah, I mean, I think the big two things are, one, more vaccines, and then unfortunately, especially in these hotspot areas, and number two, more supports for essential workers. And again, reworking what is there in the Canada Sickness Response Benefit in order to make it much more viable as a paid sick leave option for our essential workers.
Dr. Zane Chagla, thank you for that. Appreciate the info and the insight.
No problem.